Well, a representative from Save the Children said today, this outbreak is not under control. And this is what we got to see Thursday morning from the Ministry of Health in Uganda. There is a confirmed imported case of Ebola virus disease in Kasese District, Uganda. The confirmed case is a 9-year-old female of Congolese origin who traveled from DRC with her mother to seek medical care in Uganda. The child is under isolation and being managed at Bwera Ebola Treatment Unit. So that's what we got to wake up to on Thursday morning. We've previously seen cases in Uganda from the DRC outbreak. But it's been clear for a while, but here we have another case. And then this morning, Reuters reports that that same 9-year-old girl died in Uganda 1 day after testing positive for Ebola virus disease. It is true she died last night, said the official, who asked not to be named. So that's part of the Ebola news that we're looking at this past week. It's been quite a bit of it. But the other one, and this has been described as the grim milestone, is the fact that the 2018-2019 DRC Ebola virus outbreak that started on August 1st of last year has now reached 3,000 cases and 2,000 fatalities. And this is a report released from the CDC yesterday. And it says, as the outbreak in the DRC continues, the number of Ebola cases has reached 3,000 and more than 2,000 deaths. Cases have recently been reported in previously unaffected areas in DRC and are now in 29 health zones and in a new province, South Kivu, which increases the risk of disease spread both locally within DRC and to neighboring countries. Now, as of Thursday, the DRC Ministry of Health has reported 3,004 cases and 2,006 fatalities. Quote, far too many lives have been lost in this Ebola outbreak. The DRC, U.S. government, and international partners are working hard to overcome the significant challenges to stopping the spread of the disease in DRC. Close quote. This is from CDC Director Robert Redfield. CDC is prepared for a long-term public health response in DRC and its neighboring countries, and we agree with our World Health Organization colleagues about the need for a change in the response to bring this outbreak to an end. So people are finally starting to truly recognize what a big issue this is going on over in DRC. This is really an outbreak that is not under control, as the spokesperson for Save the Children said. And then this release Thursday from the World Health Organization, and they say that World Health Organization calls for the full force of all partners to respond and increase their presence in the field to stop Ebola and to address one of the largest and most complex humanitarian crises in the world. WHO Director General Dr. Tedros said, our commitment to the people of DRC is that we will work alongside them to stop the Ebola outbreak. Our commitment also means strengthening health systems to give them all the other things they need. Building strong systems is what will protect people, communities, and the world. Yeah, but to me, this has been talked about for a long time. There's not enough response. There's not enough media coverage, and I've talked about this on the program before. The media is basically absent of what's really going on here. And the thing is, it's not just Ebola. DRC is just a country in chaos, and they have lots and lots of problems with debauchery and killings and a lot of different problems. Diseases are one of the outcomes of a lot of these problems. And it says here that With a population of 80 million, the DRC has more than 4 million displaced and is home to the world's second largest food crisis with 13 million people food insecure. Well, let's talk about some of the diseases, because it's not just Ebola. They have, since the beginning of the year, outbreaks of cholera, which include over 15,000 cases and almost 300 deaths. Measles, the largest outbreak of measles in the world this year, is in the Democratic Republic of the Congo, something that is not mentioned very much at all. We at OutbreakNewsToday.com do try to cover all this the best we can, but you don't hear much about it. 161,000 measles cases since the beginning of the year, which has ended up with more than 3,000 fatalities. That's 1,000 more than the Ebola outbreak that started in August of last year. And then they say, and malaria, which is the leading cause of death in the Democratic Republic of the Congo, kills more than 48,000 people every year. So there's a lot of big problems there. And there's other outbreaks going on too. They have monkeypox, something we rarely ever hear about. And there's fatalities going along with that too. So they got a lot of different issues going on. Dr. Tedros, according to the report, says will accompany UN Secretary General Antonio Guterres on his mission to the country this weekend, along with senior officials, including the Regional Director for Africa with the World Health Organization. We are working in an incredibly complex environment, but thanks to support from donors and actions taken by the Ministry of Health, WHO, and partners, we have saved thousands of lives. Could be, sure. We strive towards a much more united approach and call on NGOs and UN partners to continue to accelerate all activities. Everyone has a role to play, and we each must be accountable for what we signed up to do. Only then can we end this outbreak. And I think that's pretty much all I really wanted to say about what the World Health Organization had to say. We kind of hear these things over and over and over, though, from some of these organizations. Not trying to be a critic, but things aren't rolling along at the appropriate speed, in my viewpoint. Because look what's happening, right? And then here's Save the Children, and this will be the last slide, and this is where I got it from. They say the Ebola outbreak in the DRC reached another grim milestone. And that is exactly what it is. It is a grim milestone. Some 3,000 people have fallen ill and 2,000 have died since August 2018. And Save the Children warns that the outbreak is far from under control. And this is from Heather Kerr. She's the DRC country director for Save the Children. And she's got some interesting things to say here with some interesting numbers. In an outbreak that continues to take children's lives and tear apart families and communities, we were extremely saddened to learn that the Ebola outbreak in the DRC has claimed 2,000 lives. This has been a particularly deadly outbreak with a mortality rate of 67%, far higher than the 55% average case fatality rate for Ebola. And the youngest are the hardest hit. Well over 500 children have died. Many more have lost at least one of their parents and can no longer go to school because schools are closed or they have to work to make ends meet. And we don't want to keep counting deaths. The international community must release new funds to help prevent the virus from spreading further in the region and causing more casualties. We must continue to work with communities to unlock the key to ending this epidemic. The government of DRC must also ensure that there are sufficient doses of the Merck vaccine to last for at least one more year and increase the number of vaccines authorized to counter the Ebola outbreak. We also call upon the government of DRC to ensure that throughout this crisis, children's education is not disrupted, making sure that schools are not closed due to the outbreak, and that quality emergency education is accessible to all children. So, what do you think? Has the international reaction been too slow, too much, or just about right? Right? This is a Goldilocks and the three bears. What can be done? Can we just funnel more dollars into it and that will solve the problem? What are the answers? DRC has a lot of problems. Will there be more attention if some of these Ebola cases spread outside of DRC farther than across the border into Uganda? What if they get to a major city in one of these African countries? The Ebola does. Yeah, there's a lot of issues here, and I don't know if anybody has any satisfactory answers for this. I'd love to hear what you got to say. Go ahead and comment below. Share the video with your friends, and this is some of the most recent information on what's going on with the Ebola outbreak in the Democratic Republic of the Congo. And if you like what you see, like what you watch, go ahead and subscribe to the channel. I appreciate that. And I'll see you next time.